My next guest is Shayanne Martin, who not only recently completed her Master's of Public Health at Johns Hopkins University, but also spent 3 weeks in Guatemala doing a qualitative interview research project in clinics in the Highlands. Shayanne, welcome to Christian Values.
Thank you.
So before we kind of get into what you were actually doing during your time in Guatemala and some of the findings and some of the more experiential stuff, could you just give a little background about how you ended up on this project and what kind of drove you to get involved in this particular space?
Sure. So while I was at Hopkins, I was studying global health and community-based public health, which are my two main interests. And they were two interests that I was introduced to actually when I was an undergrad in 2011. And I went on a volunteer trip to Guatemala. And actually, that's where I first found out about the organization I was with, Curamericas Guatemala. And at that point, I had already set up my next job and was going to go more into private sector. And but eventually I wanted to get into global health. And so last summer I left and I started my NPH at Hopkins. And while I was at Hopkins, I was telling about my experience in Guatemala. And I was presenting it in a journal club, and at the end of the presentation, the professor who was leading the journal club was like, "Shayanne, do you know who started Curamericas?" And I said, "No." And he said he did, and my face turned bright red, and I was super embarrassed, especially since I had thrown in some constructive criticism. And he ended up just inviting me back this summer to do some qualitative research. And so it was really neat going from being a volunteer and thinking there was some science behind the project and being really impressed to the other side and really being to delve into it and participate in the research.
Man, what a unique coincidence. You were driven to this by someone who ended up crossing your path again and offering you another opportunity to reinvest yourself.
It really came full circle. I still can't believe it.
So let's start at the beginning. So you get this opportunity and you decide you're going to go to Guatemala. What do you know about the project at this point, and what happens kind of when you land? Where do you end up?
So I knew that it was a project focusing on reducing infant, child, and maternal mortality. The region is actually known as the Triangle of Death for having some of the highest rates of infant and maternal mortality in the world. And their interventions were pretty simple: nutrition, hand washing, clean birthing, and going back and reading more of the operation research papers. Curamericas, actually a little background on Curamericas Global. It's a U.S.-based NGO that operates in very remote regions in Latin America, the Caribbean, and Africa. Working with local communities to empower them to provide health education, health promotion. And through their multiple partners, Curamericas has developed a framework for delivering affordable primary health care that works in very remote, impoverished settings. And Curamericas Guatemala, with their Guatemala partner, in addition to the delivery of primary health care and health education, they've set up what are called casa maternas, or birthing houses, to provide women a safe place to give birth. Because actually, becoming pregnant in this region of Guatemala is life-threatening for women, and there's actually a 1 in 20 chance of dying during childbirth over a woman's life.
I don't know, obviously, too many comparative statistics, but just hearing that number, it sounds shockingly high. What a scary thought that something that's relative, all the way natural, holds that fear. And so you go for this second experience, and this time around you're interviewing folks. Is that kind of part of what I understand you were doing?
Yeah, so we were interviewing people on the ground. They're actually community educators who are going into the community and delivering these health messages. Like I said, just like washing your hands.
Like stuff that we take all the way for granted is just still a huge problem.
Oh, yeah. And in addition to these health educators, I was also interviewing Ministry of Health staff to see how the ministry can take on the work, because sustainability is an issue. And outside funders can't fund the program forever. So trying to get Guatemala to take on the work of the project. And so I was interviewing the educators and the Ministry of Health staff to get their opinion on the project, to see how it could be improved, and to see how the project could be integrated into the work of the Ministry of Health.
What a necessary thing, kind of to your point that, we have these great programs from the states often that go into these places, but that it does need to come from within in a lot of ways. It does need to become something that is sustainable and can maintain itself for generations. So what were some of the findings on that front? What were some of the things that you saw or learned about the difficulties and potential solutions to creating a more sustainable environment?
So community empowerment is a huge theme, and making sure that the local health workers understand the science behind the project, and making sure that the reasoning reaches the people. So it's one thing to go into a community and tell mothers, okay, you need to breastfeed your child until 6 months. You need to boil your water before giving your children water. Children can't survive on nothing but rice. But it's another thing to tell the mothers why and explain to mothers that their children's growth is lacking compared to children in other countries. And this was something that the local mothers and the local educators didn't realize was so rare, and that they saw that this is important. Like, for behavior change, you have to explain why. And that, in being familiar with other health programs in other countries, that was really unique to the program. And what was also really encouraging was that the Ministry of Health workers loved the project. They wanted to take on the project, but the problem was with human resources. And globally, there's a health worker crisis. And so the challenge will be continuing to build up the local health worker supply.
And to figure out how to get those people educated and get them involved. That's what a difficult thing. What region of Guatemala were you in kind of specifically? Like, how far away are we from major city or even towns?
So that is a big part of the project. So it's called Tenango. It's a department. It's about the size of Delaware. And if you were to drive across Delaware at its widest point, or most diagonal point, it would take you about 2 hours. And in this region, it could take you an entire day, just because the roads are so bad. The project serves a 6-hour travel radius. It takes about an hour to go 15 to 20 miles. And the project staff who who are working on the research and helping to do the local training, they're traveling every Friday and Monday 4+ hours from their home to serve the community. And then the women and children who are being served, they're walking to get health services. There's a stat on families are more than about a 90-minute travel distance from a health facility. They won't go.
Really?
And in remote regions, especially in Tenango, that's 2 to 3 miles.
Yeah.
And I know back in 2012, there's the champion of this project, Dr. Mario Valdez. In 2012, he was the only doctor for 8,000 people. And that for population to have good health outcomes, you should have 2.3 doctors, nurses, or midwives for every 1,000 people.
2.3 for every 1,000, 2.3 medical staff for every 1,000, and they were working with 1 for 8,000 within a region that's terribly difficult to travel as well.
Yes. So the scale of this is mind blowing. Like, how few medical providers are, how many people there are, how low the services are traditionally. But now, the health statistics are amazing. They've twice as many women are giving birth in facilities. They've reduced child mortality by almost 40%. Maternal mortality by over 60%. And now, we're serving like I said, like 8,000 people. Now, in 2014, or actually this year, they reached almost 100,000 people that the project is now serving.
Oh, that is so awesome to hear.
And they're training thousands of local health workers now.
It's fantastic to see how there can be a difference made. And I think one of the things that's often challenging for the general population is we hear about this sort of thing, and we hear about, like whether it's something like this where it's like a health NGO or something like the Peace Corps, and we just like kind of never get to hear about the actual tangible differences that these folks make. We hear a lot more about like personal experience, and to hear those sort of statistics, like that's a real tangible difference, starting from kind of a small idea and now reaching so many folks.
Yeah, and actually, speaking of small idea, this all started from a doctor literally running house to house with a medical bag, delivering babies and trying to keep babies and mothers alive. And Dr. Mario had started he's been there for over 20 years now, and eventually got put in touch with Dr. Henry Perry, who sent me to Guatemala, or asked me to go to Guatemala. And that connection was made in 2002. And so now for over 10 years, they've been working to ramp up the project. And so you started 20 years ago with one doctor, and now you have a few thousand health workers.
That's awesome. This Dr. Valdez guy sounds like kind of like a little bit of like a hero, like this person who's really dedicating himself to something. Like, what was it like to work or talk to somebody who has gone through that and seen these changes?
Oh, definitely. Like I was talking to the principal investigator, and he put him on the same scale as Paul Farmer. Like someone needs to write his book. He actually lives in a city 4 hours away. He's sacrificed, his personal life. He does have a family. His family lives away. And I would say that he alone is responsible for saving thousands, if not tens of thousands of lives in the last 20 years. And I've never met anyone else who has done that.
Yeah.
And my Spanish is pretty poor, and it's intimidating speaking with him, and just like being in his presence. I'm like, you said it. I mean, he's a hero to these people, especially.
Mm-hmm. So after this experience and after like 3 weeks, like what were your like large takeaways returning back? Like maybe not necessarily micro stuff on specifically what does this region need and how has it worked here, but what are some of the things that you see that can maybe be applied to greater swaths of people, or just the feelings that you return from that experience with?
I think more of what I learned in 2011, which is how much we take for granted. I had sat in on a consultation with Dr. Mario, and back in 2011, and he was explaining to this couple about they needed to boil their water before they drank it. And I was like, okay, maybe you don't know that water can be unsanitary. But then he went even on to explain that they needed to water their plants so they would grow. And I never questioned that plants need water to grow. The area so Guatemala is very indigenous. I think like 70% indigenous, and there was a 36-year-long civil war between the Guatemalans and the Mayans. In this region it's a very diverse Mayan region. Local languages are spoken, and it's very underserved. Even compared to like Guatemala, like other Guatemalan cities. Mm-hmm. And so it is kind of like stepping back in time. And in 2011 and when I went back, just seeing how much that I take for granted and just the knowledge that I have that I take for granted. And also the other big thing is how important women empowerment is. Machismo is a big cultural element in this area, mm-hmm. and a lot of women have died because their husbands wouldn't let them go to the hospital because it wasn't worth it. And a lot of young teenagers are getting pregnant by older men just because they're not respected, and women or females are just expected to have kids, and if they die, so be it. So this project, one of the big components is empowering women to make decisions over their own health seeking decisions. So going to a Casa Materna or a hospital for to give birth, or even like what food to buy to give their children.
Mm-hmm. Gosh, man, what a real thing! Like what a real thing that we. It's so close to us too. That was I was lucky enough to visit Guatemala about, I don't know, I guess 6 months back now almost, and get into a couple of these like tight villages, not with the same idea, but more just kind of trekking through. Or the big thing for me is I went to a town out in the east where there's no ATMs and there's no influx of money into these economies unless people bring it in, unless people bring cash in. There will never be more or less money, and I think you go farther out into some of these areas, and that goes from money to ideas and to kind of healthcare or supplies, and then it goes even deeper. And it's a very real thing when you're there that folks need like some help or just like an influx of things. And I think it's really awesome to hear that, at least in this particular case, like not only is that happening, but it's again being successful.
Yeah, and so where I was at, it's on the Mexican border, and the town I was in wasn't even on the map. And there is no way to make money. There is no livelihood. People just live. But that's not to say that people can't. It's not like they're not doing anything. I mean, they're self-sustaining, and they're very eager to learn. I'll bring up the hand washing incidents again. I mean, the number of households that have hand washing stations in the last 4 years has increased from 2% to around 30%. So health change is possible. People have to bring in the ideas.
Mm-hmm. Yeah, I think it's an interesting thing because I think in the States a lot of times people kind of have this feeling like it's really hard to change the world or to improve things, and things are so set. But the world is so much bigger, and there are so many ways where you can go and make such a large difference. So if folks were interested in potentially getting involved in this, like, is there a website? Is there anything along those lines that they could look at, or how would you go and be a part of this change?
Yeah, so if you just do a Google search for Curamericas Guatemala,
okay.
And Curamericas is CUR Americas.
Okay.
You'll find Curamericas website in general. Curamericas Guatemala, searching that will take you directly to the Guatemala partnership.
Okay.
And there's volunteer opportunities. They actually build volunteerism into their model for the current partnership. So you can church groups or school groups can go down and actually help build the Casa Maternas and weigh babies. They can deliver vaccinations, mostly manual labor, because there is that lack of the deficient supply of health workers. Volunteers can actually go down and contribute manually to the work that's going on.
Unbelievable. Shayanne, last question. What happens next for you? What sort of impact are you hoping to make in the public health or global health space?
Good question. Well, I'm currently at USAID working on human resources for health activities. So continuing with the health workforce theme and supporting health workforce activities for HIV care and treatment and counseling. And I'm hoping my dream job is to be an advisor to a community. The third main guy that I think I should give a shout out to is another co-principal investigator, Iris Stalick. And when I was there, he was on the ground, fluent in Spanish, teaching the communities how to go out into the communities. And I was like, I want to be him or someone like him. So hopefully I get there one day.
Awesome. Well, thank you so much for sharing about your experience, and thank you so much for your insight into what's going on in this particular space. I wish you nothing but the best moving forward, and I have full faith that you will achieve what you want to achieve.
Thank you. Thanks for your interest. It's a really cool thing.